surgery is often described as a life-saving medical event, and while much of the focus is naturally placed on the patient undergoing the procedure, there is another group of individuals whose role becomes equally important during recovery, and that is the caregivers, typically family members, spouses, children, or close friends who step in to provide emotional support, physical assistance, and daily care during the weeks and months that follow cardiac surgery. And while caregiving is an act of love and commitment, it can also become physically exhausting and emotionally overwhelming if caregivers do not receive the support and guidance they need, because recovering from procedures such as bypass surgery or valve replacement often requires careful monitoring, medication management, lifestyle adjustments, and emotional reassurance. And many caregivers suddenly find themselves responsible for coordinating medical appointments, managing medications, preparing heart-healthy meals, monitoring symptoms, and providing constant encouragement, all while continuing to balance their own personal responsibilities, work obligations, and family commitments. And over time, this continuous demand can lead to what healthcare professionals refer to as caregiver burnout, a state of physical, emotional, and mental exhaustion that can develop when caregivers feel overwhelmed, unsupported, or unable to meet the constant needs of the person they are caring for. And recognizing the early signs of caregiver burnout is extremely important, because when caregivers become exhausted or emotionally drained, it not only affects their own health but can also impact the quality of care they are able to provide, which is why managing caregiver well-being is not a luxury but a crucial part of the heart surgery recovery process. And understanding how to maintain balance while providing support can make the entire recovery journey healthier and more sustainable for both the patient and the caregiver. And the first important principle in managing caregiver burnout is understanding that recovery from heart surgery is a gradual process rather than an immediate return to normal life, because many caregivers initially assume that once the surgery is successful, the recovery will be quick and straightforward. But the body requires time to heal from major cardiac procedures. And during the first several weeks, patients may experience fatigue, emotional vulnerability, temporary discomfort, reduced stamina, and periods of anxiety or frustration, which can make caregivers feel responsible for solving every problem or easing every difficulty. However, the reality is that recovery involves ups and downs, and learning to accept this natural healing timeline helps caregivers avoid unrealistic expectations that can create unnecessary stress. The second important strategy for preventing caregiver burnout is learning how to share responsibilities and build a support network, because caregiving should never be a one-person responsibility. When multiple family members or friends are available to help, even small contributions such as assisting with grocery shopping, helping prepare meals, accompanying the patient to follow-up visits, or simply spending time with the patient while the primary caregiver takes a break can significantly reduce stress and prevent emotional exhaustion. And caregivers should feel comfortable asking for help rather than assuming they must manage everything alone, because shared caregiving strengthens both the caregiver's resilience and the patient's emotional support system. Another key strategy involves establishing healthy routines and structure during the recovery period, because when caregiving responsibilities are unstructured, they can easily become overwhelming. But when caregivers develop simple daily routines such as scheduled medication times, planned meal preparation, gentle walking schedules for the patient, and designated rest periods for both patient and caregiver, it creates a predictable rhythm that reduces anxiety and improves overall efficiency. Routines also help patients regain a sense of normalcy and independence, which gradually decreases the caregiver's workload as recovery progresses. A fourth essential element of preventing caregiver burnout is maintaining the caregiver's own physical and emotional health, because caregivers often place their own needs at the bottom of the priority list, skipping meals, sacrificing sleep, neglecting exercise, and postponing their own medical appointments while focusing entirely on the patient's needs. However, this approach can quickly lead to exhaustion, irritability, weakened immunity, and emotional fatigue. And it is important to remember that caregivers cannot provide effective care if their own health deteriorates, which means maintaining balanced meals, staying hydrated, getting adequate sleep, engaging in regular physical activity, and taking short breaks throughout the day are all essential components of sustainable caregiving. Emotional self-care is equally important because caregiving can bring unexpected emotional challenges, including fear about the patient's health, anxiety about complications, frustration with slow progress, or even feelings of guilt when the caregiver takes time for themselves. And acknowledging these emotions without self-judgment allows caregivers to process stress in a healthy way. Practices such as mindfulness, relaxation exercises, journaling, or talking openly with trusted friends or family members can provide emotional relief and prevent internal stress from building up over time. The fifth strategy for managing caregiver burnout involves maintaining open communication with healthcare professionals and the patient. Because caregivers often carry concerns silently when they are unsure whether certain symptoms are normal during recovery or when they feel uncertain about medical instructions, and maintaining clear communication with the healthcare team helps caregivers feel more confident and less anxious about their role. Attending follow-up appointments, asking questions, and understanding the patient's recovery milestones provides clarity and reassurance that reduces uncertainty. Equally important is open communication between the caregiver and the patient. Because recovery can sometimes create emotional tension when patients feel frustrated by temporary limitations, or when caregivers feel overwhelmed by constant responsibility, and discussing expectations, progress, and challenges openly allows both individuals to support each other with empathy and understanding. Another often overlooked factor in caregiver well-being is recognizing the importance of small moments of rest and personal time, because even short breaks such as a 15-minute walk outside, reading a book, practicing a hobby, or spending time with friends can recharge mental energy and prevent emotional fatigue. These moments of self-care are not selfish but necessary for maintaining long-term resilience, and when caregivers allow themselves to rest, they return to their role with greater patience, focus, and compassion. It is also important to understand that recovery from heart surgery is not solely physical but emotional as well. Many patients experience temporary mood changes, anxiety, or feelings of vulnerability during recovery, and caregivers often become the primary source of reassurance and encouragement during this period. However, caregivers should remember that they are not expected to solve every emotional challenge alone, and professional counseling, cardiac rehabilitation programs, or support groups can provide valuable assistance for both patients and caregivers navigating the recovery journey together. As the weeks progress and the patient gradually regains strength and independence, the caregiver's role naturally begins to shift from intensive daily support toward encouragement and guidance. And this transition is an important milestone because it reflects the success of both the surgical procedure and the recovery process. Ultimately, the goal of caregiving during heart surgery recovery is not only to assist the patient but also to create a supportive environment that promotes healing, stability, and emotional resilience for everyone involved. And when caregivers learn to balance compassion for their loved one with care for their own well-being, they transform the recovery process into a shared journey of healing and strength rather than a burden carried alone, reminding us that sustainable caregiving depends not on endless sacrifice but on balanced support, healthy boundaries, and the understanding that taking care of yourself is an essential part of taking care of someone else.